So in this lecture, let us discuss about first aid and triage. So the prerequisites for first aid and triage is, triage is the process of prioritizing the patient's treatment during mass casualty events, ATLS. So patients are classified according to the type and urgency of their conditions to get the right patient to the right place at the right time with the right care provider. So the learning objectives of today's lecture gonna be: describe the key elements of disaster triage, understanding the basic principles of massive casualty triage. So start. So performance objectives of today's lecture will be: at the end of this course, the students should able to apply their principles of disaster triage and understand the concept of reverse triage. So the overall objectives of this lecture will be the describing the key elements of disaster triage, understanding the basic principles of massive casualty. So let us see the introduction of triage. So triage means it is a method of quickly identifying victims who have immediately life-threatening injuries and who have the best chance of surviving. So that is called a triage. So the tagging of triage include complement triage, rapid identifying of patient, color-coded, bar-coded system, plastic bands, and can be used as a substitute tags for triage kit. So the basic description of triage kit and its color include red, yellow, green and black. So red color means top priority. So may survive if given immediate simple life saving measures. Yellow means should survive if given within hours. Green means walking with wounded, minor injuries that can do that do not require rapid care. And black means deceased or severely injured patients unlikely to survive is called black color triage. So depending upon the START system, so it is created in 1980s by Hawk Hospital and the Newborn Beach CA Fire Department. So allows a rapid assessment of victims. It should be taken not more than 50 seconds. And once victim is treated, area from detailed assessment should be made. So the classification based upon the three items include respiratory triage, perfusion triage and mental status evaluation. So these are the overall classification of the triage. So we have minor and immediate. So respiratory, if the patient has any respiratory problems, then he need to go for immediate or perfusion. If it is perfusion, then we need to go for immediate or delayed. So this is the triage classification. So triage first step. So the first step in triage is we need to whether the patient can able to walk or not. If he can able to walk, then it is a green. If he is unable to walk, then he need to have a ventilation. Then the step 2 will be ventilation. If he need ventilation, then what type of ventilation he need? He need an immediate ventilation or small ventilation. If he has an open airway obstruction, then we need to give either he need a ventilation or not. If he need a ventilation, then we need to keep him as a red or immediate triage. If he does not need a ventilation, that means he need to be keeping a black triage. Then step 3 of triage include circulation. If he has a proper circulation, then he can be evaluated for consciousness. If he don't have any circulation or absent of burial pulse, then he need an immediate and red colored triage. So the fourth step of triage will be level of consciousness. If the patient is conscious, then he can go for yellow triage. If he is not responding to the comments, means then we need to go for immediate triage. So contaminated patients. So patients with exposure to containments should be tagged as blue. So this category will continue to say until the patient is adequately decontaminated, then follow START as usual. So some recommended as a double tagging with blue and standard START color. So the START overview. So remember RPM. So RPM stands for respiration, perfusion and radial pulse and mental evidence based. So reverse triage means used in mass casualty lightning injuries. So the dead are treated first, high potential for respiratory arrest and potential for respiratory success. So the conclusion of triage is, so triage is a method of quickly identifying victims who have immediate life-threatening injuries and who have the best chance of surviving. So the key elements of triage system include respiration, perfusion and mentation. So the reverse triage is used for mass casualty lightning incidents. So this is the reference that I took, and thank you very much for this lecture. So thank you very much.